we're going to talk about one of the conditions we frequently treat in our clinic, which is cervical facet syndrome. Neck pain is a very common condition for which patients seek treatment, and it can arise due to many factors. It can be an acute injury to the neck, such as seen in a car accident or a whiplash injury. We can also see it in a sports injury, such as a football player impacting their head or neck in tackling. Many times it's seen in a work situation where an individual is working for a prolonged period of time, keyboarding and looking at the monitor with their neck not in an ideal position, and they develop neck pain. Or in a working man, such as a painter, painting overhead where they're constantly extending their neck, they begin developing neck pain as a result of their repetitive work activities. And so they then seek treatment. One thing to be aware of is most of the time neck pain is self-limited, which means within a short period of time it resolves. So if you develop neck pain, be patient. Many times it can improve on its own. The first step in doing any form of treatment is obviously consulting a specialist. You can see a medical doctor, orthopedic doctor, pain management physician, or see your local chiropractor or physical therapist for initial advice. If the pain is not resolving early on, we usually obtain x-rays, check for alignment of the neck, and later on, if the pain is not resolving, an MRI study is usually performed, which gives us more valuable and detailed information. Why is facet syndrome important? It's because based on our knowledge, we feel that about 25 to 60% of neck pain is attributed to pain arising out of the facet joint. The facet joints are the joints that join one vertebrae to the next, and they can become inflamed and painful. There are certain characteristic findings of facet syndrome on clinical exam. Most reliably, there will be soreness over the joint. So we can palpate or feel the area of the neck and see if there is soreness over the joint. And then you can also check for motion. So frequently movement of the neck is limited and pain is experienced with motion, either bending, extending, rotating, or twisting the neck. Most sensitive is actually extending the neck and twisting it, as this puts additional stress on the joints of your neck, and if the pain is reproduced, then you may have facet syndrome. I emphasize that we do obtain x-rays and MRIs, but actually you can have facet syndrome with completely normal x-ray and normal MRI, and facet syndrome is actually established or diagnosed by doing an injection. So it's very interesting many times when you're seeking authorization through the insurance for doing a facet block or injection for diagnosis, the reviewing physician, who's probably not well informed, says there's no indication because the x-ray or MRI is normal and there's no reason to do an injection. But in fact, you cannot establish the diagnosis of facet syndrome without doing an injection, because if you inject those joints that are painful and the pain resolves even immediately, this proves that there is inflammation of the joint. If the injection doesn't provide pain relief, then it may not be related. So when we do an injection, the criteria usually to get substantial pain relief, somewhere in the range of 50 to 70% at least. And frequently the injection may be repeated a second time to confirm. Studies indicate that if you do 2 injections, you may have more accurate conclusions regarding facet syndrome. So let's go back to the idea that you have to have something abnormal on the x-ray. And actually studies show that if you have facet arthritis, that doesn't mean you have facet syndrome or facet pain. As you know, many individuals may have an abnormal MRI or x-ray showing arthritis in the joints, but may actually have no pain. And studies have shown that if you have arthritis, let's say at a level between C5 and C6, that may not be the painful joint, but the painful joint could be, for example, C3, C4, and the only way you diagnose which joint is painful is, again, by doing an injection to see if it is painful. So the etiology of facet pain we discussed includes whiplash injuries, which are actually the most common source of facet syndrome. But again, it could be a sports injury or just with repetitive work activities. Whiplash injury, which frequently occurs when you're a passenger or driver in a vehicle and the vehicle is rear-ended forcefully, can cause neck pain because of the sudden flexion extension of the neck. And actually biomechanically, as we discussed in a prior video, the neck goes into an S-shaped curve, and then frequently neck pain is noted. Now, frequently X-rays and MRIs may show minimal or little findings, but actually they've done autopsy studies, and a published report in Spine in 1990 indicated that they actually did cadaveric studies, which means they opened up people that had died in a car accident, where the radiographs or MRI were normal, but they actually found bleeding in the joint capsules, in the facet joints, tearing of the ligaments, and damage to the spine, which was not detected on routine X-rays. So you can actually have true damage not detected on X-rays or even an MRI study. We know that when you get a whiplash injury or neck injury, 80 to almost 100% of patients develop neck pain. So that's the most common injury after you get rear-ended, is neck pain. The second most common is actually headaches, which frequently are related to the neck injury. And they frequently, the ones that are from a neck injury, arise in the back of the head, and they may radiate to the front of the head, even forward to the eyes. And these are commonly associated. The third injury that we see with this most commonly is actually a shoulder injury. And many times, the shoulder injury is really the pain coming from the neck. So for example, many patients explain that, oh, my shoulder is hurting, but pain in this area, trapezius, frequently arise out of a facet injury of the neck and not related to a shoulder injury, where the pain is more likely further in the arm and down. And so pain in this area, we have concluded that is likely due to the neck injury. And then many times patients also get paresthesias, or numbness and tingling in the arm. And sometimes this is termed cervical radiculopathy, but we know that almost a third of the patients with a severe whiplash get numbness and tingling cessation, and yet the MRI may not show a significant disc or a pinched nerve, but this is a secondary symptom to the whiplash injury. So studies by Dr. Lord and other associates showed that that facet pain is 60% of neck pain. So if you have a neck injury, more than half the time, the pain comes from inflammation of the facet joint. And this is very important because some of the treatments may not be effective in treating facet pain. So, for example, I will go forward, and that sometimes, for example, surgery is recommended as a fusion of the neck. And this is usually not effective in reducing facet pain, because even if you do a fusion, which is usually done from the front, there's some motion of the facet joint. And furthermore, we know that when you do a fusion, actually there's more stress on the adjacent facet levels, and actually your facet pain may increase. You can do a disc replacement surgery, and once again, the disc is replaced, but the facet joint still moves, and you can have continued pain, and so your problem doesn't resolve with surgery. So it's very important that the diagnosis of facet syndrome or facet pain be established, and really the best way to treat this is to do a facet block. Now, you don't want to do a facet block as the first thing. If you have neck pain, remember, tincture of time is important. Pain will get better. Then the usually standard of care is to initially seek treatment of several weeks with a chiropractor or physical therapist. This is very important because they can do treatments that can help resolve the neck pain. And they can also guide you in doing home exercises, strengthening exercises, paying attention to posture. So for example, Poor posture can be a contributing factor to developing neck pain, and your physical therapist or chiropractor can give you advice regarding managing that. And use of some light medications are important. We use Tylenol or an anti-inflammatory medication such as Motrin or meloxicam, and this can be effective. But let's say all these fail and you have signs and symptoms of cervical facet syndrome, once again, soreness over the joint, pain with range of motion, no radiculopathy, then you may be candidate for facet injection. So if you have radiculopathy, which means the MRI shows a pinched nerve in the neck, then you'd be better off to do an epidural injection, which is more likely to help your pain. And again, the surgeries I talked about, fusion or disc replacement, are more appropriate for radicular pain or radiculopathy, not for facet pain. And once again, facet pain is actually one of the most common causes of neck pain, which can be missed if the doctor is not looking for it. So there are certain criteria that are recommended for doing this, and I refer practitioners to an excellent review article, which is called Consensus Practice Guidelines on Intervention for Facet Joint Pain from a Multi-Specialty International Work Group. This was published in Pain Medicine in 2021 by Dr. Robert Hurley and multiple associates. And it's an excellent study. It goes over all the scientific data we have on facet injuries and facet pain and its treatment and treatment recommendations for facet pain. What is done in a facet block? Well, what we're doing in a facet block is we're basically numbing or anesthetizing the nerves that go to the joint. So each cervical joint is innervated or gets feeling from a medial branch of the dorsal ramus of the cervical spine. And so each joint, let's say C3, C4, is innervated by a branch from C3 and C4 nerve roots. So it's important to block both of those nerves if you're dealing with C3, C4 as being likely the source of pain. C2, C3 is different in that actually the third nerve or the third occipital nerve gives a branch that gives sensation to C2, C3, and then it also gives a branch that gives to C3, and then for C3, C4, there's a branch from C4. So C2, C3 is very important because that's felt to be one of the common causes of neck pain. And involvement of this nerve or irritation can cause not only pain at the base of the neck, but also produce headaches, which we term cervicogenic. And again, that pain can be a headache which radiates to the forehead as far as even the eye. And an injection at that level may relieve that headache and establish a diagnosis of cervicogenic pain. Without the injection, you don't have a clear diagnosis. The cervicogenic headaches may also be related to pain from the Atlanto-occipital joint, which is basically the between your upper cervical spine and the base of your head, and that joint can be painful and produce headaches, or the Atlanto-axio joint, which is between C1 and C2, and that can be a source of pain. And sometimes injections of those areas can give you results if the pain may be generated. Those are advanced techniques and usually best reserved for individuals that are highly specialized in doing those injections. And so this is done usually with either local anesthesia, where you're fully awake and we do the injections, or if you're highly anxious or nervous, some light sedation can be provided. But we don't recommend deep sedation because it's actually more risky and more potential complications. So the more awake you are, the more accurate the test. So we use fluoroscopy or a live x-ray to look at your neck. So this is a model. And then we identify what we think are likely the painful levels based on your pain report. So how do we determine that? Well, again, if you're having a lot of pain at the base of your head and upper neck, C2, C3, the neck level can be C3, C4. C4, C5 is going to be at the base of the neck. And then C5, C6 is going to be the upper shoulder blade, trapezius area, and even the shoulder. That's C5, C6. And then C6, C7 is even lower. So there are pain drawings that actually help guide us to which levels we would want to inject. So you're brought to the special procedure suite or operating room, and the x-rays, live x-ray can visualize it. And then we numb up the skin and carefully use a needle, it's a spinal needle, and guide it. So we're targeting the nerve and not the facet joint. The nerve lies in a little gully that's in every vertebral body, and the ideal position is right here in a lateral gutter between each facet joint. And again, you want to go one above, one below to get anesthetize that joint. The recommendation is to use a very small amount of anesthetic, either lidocaine, which lasts for about an hour, or marcaine, which lasts 3 to 4 hours. A very light dose because we don't want it to spread to other issues, so half a cc is felt to be adequate. Using steroids is optional. We prefer to use steroids because we feel it gives a little bit longer relief, but the diagnostic block, technically is frequently also performed with just a local anesthetic. And then we look to see if the pain is relieved. So typically we will do several levels, C3, C4, C5, or maybe also do the third occipital nerve if there's headaches, or if the pain is lower, maybe more in your shoulder or between your shoulder blades, do C4, C5, and C6, and see if the pain is relieved. If there's excellent relief, again, 50, 70% relief, and sometimes the injection is repeated for accuracy, a procedure is provided with a radiofrequency ablation, which provides even longer pain relief, and I plan to discuss that at a later discussion. Once you've made the diagnosis, there's more definitive treatment, and a radiofrequency ablation can give you relief for 3 months to a year of relief. Usually the blocks themselves, the diagnostic blocks, have short lifespan of helping, but we've had patients that get excellent pain relief even with a diagnostic block. Now, some doctors do what's called intra-articular injection, which is actually then putting the needle in the joint and maybe using steroids to help that. That's becoming less popular because although you do get relief with an intra-articular injection, you cannot really follow that up with a radiofrequency ablation, which gives you much more pain relief. So if you get temporary relief with an intra-articular, the treatment is to do the intra-articular injection again. But the radiofrequency system of ablation can provide you with much longer pain relief. So it is considered the preferred method of treatment. So once again, neck pain can have multiple etiologies. Initial treatment is an evaluation by an experienced physician, radiographs, and a later point MRI. Brief course of physical therapy or chiropractic is often beneficial. Using light medication, Tylenol or Motrin can be also helpful. If the pain is not resolving and the doctor suspects you have cervical facet syndrome, the injection can help diagnose the condition if it's painful. If you don't have any relief from the facet block, doesn't mean you don't have pain. Sometimes you have to do a different level to see if the pain is coming from other levels. Or then maybe attention should be turned that the pain can have other etiologies, such as pain arising from the bone, from the disc, or soft tissues, where other treatments can be offered.